In the RESPECT trial, which was addressing again the HER2 population, I think what was quite interesting was the first trial really focused on elderly patients, and so you had to be between 70 and 80 and have HER2-positive breast cancer. And they randomized patients to 12 months of monotherapy with trastuzumab or trastuzumab with chemotherapy. And I think what was exciting, they didn't meet their primary endpoint, but what we saw was so few events in both arms. And so we had 18 recurrence events at 3 years in the trastuzumab only arm, 12 in the group that got chemo plus trastuzumab. So I think it really says these patients are doing well with HER2 therapy. When we look at, what some of the differences, were, I think one of the key messages were that the elderly patients did really well with standard of care of chemotherapy in combination with trastuzumab. So I think it gives us great confidence to move forward and offer standard of care chemotherapy. I think on the other hand, we have patients that may get a dose of chemotherapy, may not want chemotherapy, and the differences were small. That trastuzumab monotherapy may be an option for patients that don't want to move forward with chemotherapy, and I think the expectations are, they were close to 89% 3-year disease-free survival, which is pretty good with just trastuzumab therapy alone. And so I think that just again makes us feel more comfortable when we're stepping away from our standard of chemotherapy with HER2 targeted therapy and just offering HER2 targeted therapy. Again, I think I would tailor it in my practice to a patient that may have many comorbid problems, just not a good candidate for chemotherapy, but may be able to undergo the trastuzumab therapy and would move forward with that.